Dear friends and colleagues, welcome to Science of Massage Institute. We will discuss how to use inversion table as a tool for ultimate decompression of the lower and middle back. Inversion table is not a treatment option. That's the common mistake which made by the patients. They're using that as the treatment tool. In reality, inversion table is the prevention measure after clinical symptoms eliminate. We have many patients in our clinic who tried to use inversion tables before and were not successful, actually sold the table because they didn't feel any relief, or in some cases actually inversion table made symptoms worse. One of the first important things, inversion table cannot be used during acute pain, especially if the patient has so-called peripheral neurological symptoms, when pain accompanied by radiation along the extremity to the foot, to the leg, or to the middle back. If these symptoms already controlled by the therapy, and now it's time to give patient homework, to give patient tools to prevent pathological changes in the lumbar thoracic spine happen, that's the time when introduce inversion table as a preventive measure. Inversion table is platform which moves in upside down position. It allows patient to tilt it back under different angles and use patient body weight as the ultimate decompression force of the lower back and middle back. As you can see here on the side of the inversion table, or sometimes at the back of inversion table, there is stabilizers which allows patient to use specific angle for the decompression. As you can see here, this is the first position which parallel to the floor. If I will put stopper in the second hole, it gives you approximately 45 degrees. That's the patient feet, here is the patient head. If I will put stopper in the third position, it gives you approximately 60 degrees. Never ever go above the 60 degrees of tilt. Otherwise, you're fighting with your own brain, which blocks decompression force. So the 60 degrees is the maximum, but in many cases 45 is enough if it's done right. So what we will discuss right now, how to use inversion table in the way that the body able to integrate inversion table as a part of daily routine. It allows to eliminate tension which built in the lower and middle back from the previous day. The tension is not piled on top of each other until it reach critical level and the symptoms appear. So this is why inversion table such a critically important tool to let patients live healthy, productive life without spending time and money on unnecessary therapy or even surgical intervention. And this is why what we'll discuss right now, how to use that correctly, and we will ask our director of service, Julia, to help me with the application. Usage of inversion table requires preparation. First of all, client need to take hot shower and put hot water on the lower and middle back. Not standing, but move around, let muscles work under hot water for approximately 2-3 minutes. After that, patient need to do stretches for the lower leg to prepare for the inversion table. We will put link to this set of stretches in the description below. Only after hot shower and stretches, patient will go on inversion table. We never do it on the cold muscles, on the cold tissue. The tissue needs to be prepared for the inversion table, achieve maximum results using weight of the body as the structural force of the compression. Before inversion table starts, patient need to put alarm clock for 2 minutes. Never exceed 2 minutes at the first session. However, there is possibility that 2 minutes will be too long for the patient. So, how to know where to stop? If nothing bothered them while they're on the table, 2 minutes is the maximum. They need to get off the table. If, however, they feel any new uncomfortable sensation while being on the table, they need to stop. It can be a minute, it can be a minute and a half, it doesn't matter. They need to immediately get off the table. So if nothing bothers them, 2 minutes. If something bothers them, they need to stop. And that's called threshold of tolerance, which need to be detected during the first session. We'll discuss later how to manipulate with time. Here is the starting position. Julia will lay down. She slowly turns herself upside down using leverage. And when she gets in the position, when her head right now at 45 degrees, then she put her hands on the chest, never put them above the head. And this is critical moment. Patient need consciously, slowly relax lower back muscle, because the mistake people do, they are hanging in this position after using lower back muscles to get on inversion table. And they just hanging on the muscle which continue to work, and it actually makes situation and clinical picture worse. So when they in this starting position, the first critical point is slowly relax lower back muscles, keep hands on the chest and close the eyes. Wait for 2 minutes. When 2 minutes pass and nothing bothers, then Julia will get herself in the vertical position. If patient has blood coming into his or her head, there is another option. They can put pillow on the table and actually tape it, duct tape to the position when the head is. And now they can do it with the pillow, which prevent excessive blood flow. That's another option. First session, 2 minutes. Patient need to do exactly the same thing. Hot shower, stretches, and 2 minutes for 3 days. On the 4th day, they add another minute. Now 3. They do 3 minutes for 3 days. On the 4th day, they add another minute. 4. Do 4 minutes for 3 days. And at that moment, there is 2 options. If the patient already have result, stay with 4 minutes after hot shower and stretch. If patients still have residual tension, then the angle can be increased to 60 degrees, but the time need to cut to 1 minute. And from 1 minute at 60 degrees vertical tilt, you're doing exactly the same chain of event. You're doing exactly the same protocol. First 3 days, 1 minute. On the 4th day, another minute. 2 minutes, 3 days, and then another minute until you reach 3. At 60 degrees, don't go to 4 minutes. You stay with 3 minutes only with the same preparation. And that allows patient to completely control pressure within the lower and middle back, decompress lumbar disc, prevent surgical intervention, and wait for the natural drying of the disc and the natural ossification, which will be ultimate solution for any disc abnormality. And it can be achieved by the 2 things: by therapist who decompresses soft tissue first, and then patients start to use inversion table at home to prevent further deterioration of the disc and the soft tissue in the lumbar and thoracic spine. If you have any questions, please leave your comments below and we will be happy to answer them. You can also share with us your own examples of the clinical application of inversion table. And for the therapists, join us in the medical massage certification when we will work together to bring your practice to the new level of clinical expertise. Thank you, and I'll see you later. Bye.